Hi, I'm Michelle Kenway and welcome to Pelvic Exercises. Today I'm going to teach you some strategies to find and feel your pelvic floor muscles working. If your pelvic floor muscles are weak or if you've never exercised them before, it can be really hard to know whether you're actually contracting those muscles at all or whether you're doing the exercises correctly. So it's really important that you know how to find the muscles and feel them before you start exercising them. So before we start doing that, I'd like to show you how to find where your pelvic floor muscles are. This is a pelvis, a female pelvis just like yours. Just to orientate you, these are your pubic bones at the front, and there's the tailbone at the back. Underneath there's the pelvic outlet. Now your pelvic floor muscles actually sling like a hammock between the front bone and the tailbone, and they're a supportive hammock in through that area, holding your insides in and helping improve you, or helping you with your continence. So they perform a very important role in that area. There's a couple of layers through that area, and these bones here are the bones that you sit on. So you can see that they're not muscles outside your pelvis, they're actually inside. They're not your buttocks, they're not the inside of your thighs, they're actually inside, in and around that area where you sit. All right, now I'd like to show you some techniques to find and to actually feel those muscles working. The first technique I'd like to show you is a technique that involves you feeling or using a finger on your perineum, which is the area between your vagina and your anus, to actually feel that area of skin lifting as you contract your pelvic floor muscles. Now, a proper pelvic floor contraction feels like a lift and a squeeze inside that area. It feels like tightening and squeezing in through the anus or your back passage. It feels like a lift and squeeze through your vagina, and it also feels like a tightening, squeezing sensation in and around your urethra or the urine tube through where your urine passes. So that action happens inside in that sort of an action. So let's try and do that and find that feeling by actually touching our perineum. So to get yourself comfortable to perform this technique, if you lie on your side, and I use a pillow between my legs so I can access that area of my perineum. So just lying down onto your side, take your first or second finger and place it on that area of skin between your vagina and anus. So you can do this with clothes on, as I'm clothed now, or you can do this directly onto your skin. Now if you feel that area, lying comfortably there, make sure that you've got a really nice inward curve in your back. And what I want you to do is try and lift and squeeze through your back passage. Try and draw up through your vagina. Try and tighten in around the urethra as you're feeling that area. What you should feel is the area of skin above your finger, or that your finger is resting against, just lift inwards slightly. Can you feel that as you draw up and in? Can you feel that area just lift inwards just a fraction? Can you keep lifting it? Can you keep going and keep breathing? Keep lifting inside and keep breathing, and slowly lower it right down and fully relax. How did you go? Could you feel those muscles contracting? If you can feel that area lifting, that's your pelvic floor muscles. If you can feel it bulging, you're probably not doing the right action. Okay, let's try again and see if you can feel that area between your vagina and anus lifting up inside. Here we go, ready and go. Lift it up inside, keep lifting. Keep lifting and squeezing through that area, and keep breathing and slowly relax it down. Now that's definitely an exercise worth practicing. All right, let's move on to our second strategy to find your pelvic floor muscles. The second technique is to help you find and feel the muscles in and around the front part of your pelvic floor, the area in and around your urine tube, in and around the urethra, which can often be very hard to find and feel. The first thing you need to do is sit yourself nice and tall. So good posture is very important for pelvic floor exercises. The second thing you need to do is take your hands, place the heel over your hands over those pelvic bones at the front there. Then point your fingers down in the direction of the pubic bones that I showed you before. So you're resting your hands gently over your abdomen. You can also do this exercise lying down if you'd prefer to. Now what you need to do is try and visualize or imagine drawing your fingers together and drawing those bones of your pelvis together, the bones underneath your fingers, so that they're moving together. Obviously you can't move your bones, but try and imagine that you're actually doing that, and you should feel your lower abdominal area tightening just a fraction. Let's try and do that. So try and feel that area moving and those bones moving together, and that area tightening in and around that area. Can you feel that contraction? Keep holding it. Keep holding it. Can you feel the area around the urethra just tightening a fraction? And relax down. Did you feel a gentle inward movement of your lower abdomen? That tells us that you're actually contracting those lower deep core muscles as well as some of your pelvic floor muscles. Let's try that one more time. So hands over your hip bones, your pelvic bones, fingers over those pubic bones, and try and imagine drawing your hands together but using your muscles. You can also imagine trying to stop the flow of urine. So if you're drawing up and squeezing through your urethra, that urine passage, try and hold that there. Keep holding that, keep holding, and relax it down and rest. Okay, how are you going with all those techniques? Going okay? Let's start to try and practice a third technique, or use a third technique, which involves actually feeling the muscles inside your vagina. And this is a technique that physiotherapists use to assess and feel how your muscles are working, and to check and see whether your muscles are strengthening as well. So if you imagine my hand is my vagina, the back vaginal wall is the wall that's closest to the rectum, or my back passage, and the sides of the vagina on the circumference of my hand. So use 1 or 2 fingers, lubricated, and you can try inserting them. So if I insert them this way so you can see what I'm doing, in and against the vagina, so to about a depth of 3 to 4 centimetres. What you'll feel is the back wall of the vagina just tightening and lifting slightly forward against your fingers. It was just a very, very gentle movement. So you'll see just a gentle lifting forward of that back wall as you lift and squeeze in through your pelvic floor muscles and down. If you separate your fingers apart, what you should feel is the side walls squeezing together against your fingers. So a gentle squeeze inside. So you're looking for both actions to happen at the same time as you contract your pelvic floor muscles. The back wall of your vagina moving slightly forward, and the side walls actually squeezing towards the midline. Now the best position to practice this in is lying on your side once again. So let's go back into side lying, that first position that we were in. Coming down, once again put a pillow between your legs, lying right down, and obviously then you'd be disrobed in a private place. Lubricate 1 or 2 fingers, and actually use those fingers inside the vagina against the back wall or the side walls, and try to draw up and in, and try and feel that your vagina tightening and lifting and squeezing as you contract those pelvic floor muscles. Remember, once again, it's important to have your inward curve in your back, and keep breathing normally as you hold your pelvic floor muscle contraction. Let's try that together if you're trying that now. So inserting your fingers into the vagina, and try to lift and squeeze inside. Keep breathing and lifting, breathing and lifting, breathing and lifting, and then relaxing fully and letting the muscles completely relax back to their comfortable resting position. Remember, it's important to take a moment to rest and recover your muscles before trying again. And you're trying to feel that lifting and squeezing action, once again, not a bearing down action. You're not feeling your bottom muscles tightening. You're not feeling your inside thigh muscles tightening. All that exercise, all that action is taking place inside your pelvis. Okay, so let's summarise what we've done today. We've talked about the location of your pelvic floor muscles inside your pelvis. We've also talked about some strategies to finding your pelvic floor muscles. We've talked about using your finger on your perineum to actually feel a lifting sensation. We've talked about trying to use your hands on the front of your pelvis and trying to feel a gentle tightening feeling, a tightening in and around the front part of your pelvic floor. And very finally, I showed you how to actually feel the muscles inside your vagina. So once again, it's a matter of practicing regularly and finding out which technique works best for you. You'll find that after practicing using these techniques, you should no longer need to use them as often or frequently when you're practicing, and you'll start to feel the pelvic floor muscles working without using those techniques at all. So once again, practice makes perfect, and here's to your healthy pelvic floor with lots of pelvic floor practice.